If you are a senior citizen on Medicare, you need to pay special attention to this video. There is a letter that is going out and you're going to receive it this month. You cannot ignore that letter because in that letter is your roadmap to understanding all these changes that are happening to Medicare. And there's been a lot of them I'm going to talk about. And included in its letter are the roadmap on what you need to know for open enrollment that is coming up in order to ensure that in 2026 that you are going to be in the right Medicare plan that supports your needs, meets your budget, and allows you to be in the doctor and hospital and drug network that you need. This is important, so I want you to stay with me because there's critical information I'm going to share with you this afternoon that is going to give you peace of mind about Medicare this open enrollment. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that affect seniors. If you are new to my channel, welcome. I am glad you're here. Do me a favor, go into the comment section and let me know your city and your state because I like to know where you guys are watching my broadcast from. If you've been watching my channel for a while, welcome back. There is a lot to cover. In addition, the big beautiful bill made some changes to Medicare that you need to be aware of if these are benefits that you were depending on. So I'm going to cover the impact of the big beautiful bill on Medicare and specifically how does that affect you going forward in 2026 and the care and the programs that you depend on or need for your medical coverage. So let's start with the news. There has been a lot in the news about Medicare lately, and some of it is frightening. For example, 1 million patients were, dropped for a Medicare Advantage plan recently. That is creating a lot of headache for seniors in those regions. But that is not all. There are other things that are happening with Medicaid coverage that are very concerning. Another one that I'm going to share with you is about changes that are happening that is covered in this article by Kipling, the Investopedia is talking about 10 changes to Medicare that, we are going to talk about today. 10 big changes in Medicare in 2026, higher premiums, drug price drops, and looming program cuts. The program cuts, some of them are part of the big, beautiful bill. Hidden in that bill are things that are going to impact the way you access care going forward in 2026. But let's talk about the big elephant in the room, which is the annual notice of change letter. What is this letter? Well, the annual notice of change letter, it is the letter that is sent out to all Medicare Advantage and Part D enrollee before September the 30th. This letter could directly affect how you access healthcare and your out-of-pocket costs. So let me share something else for you to understand how important this letter is. So what is this letter? Well, it is required by law and explains new terms, premiums changes, deductible changes, co-pays, drug coverage, and provider network changes. Think of it as your roadmap to navigating open enrollment, which is coming up soon. Why is that important? Well, a lot of seniors falsely think that their Medicare plan remains the same, so that if they are with the same provider, nothing changes. But even if you think nothing is changing, there are things in the fine print that if you don't pay attention to, you are going to then be stuck with money and, most importantly, a loss of coverage. So the annual notice of change letter is the government's way of forcing the insurance companies to be open and honest with you and tell you in specific areas what is changing with your plan. So what are some of the things that change with this? Well, let's talk about it. The annual notice of action explains your plan's new premium terms And all Medicare Part B and Part D providers must send it to you. It is required by law, and that guides you through what you need to do, whether your current plan meets your needs or whether you need to switch. So they send it to you by September the 30th, so that when open enrollment starts on October the 7th, you are ready. Sorry, October the 15th, that you are ready, because open enrollment, I think, runs from October. Let me get my dates correct. It ran from October 15th to December the 7th. So now I'm going to unpack what the letter is supposed to do, or what is included in this letter. So bear with me. I am going to share some more information with you. So the next thing we're going to talk about is what is in this letter. Well, there are important things, and here are three of them. The first one is hidden cost. Your annual letter exposes premium increases, co-pay adjustments, and higher deductibles. So what should you do with that information? Well, if you get to the point where you realize that the premium increases are too much for you, or the co-pays are not what you were expecting, or your deductibles are higher, then when it comes to open enrollment, now you can shop for a better plan. The second thing that is included that I want to talk to you about, and this is really critical, so stay with me. It has to do with provider changes. If you've been paying attention to the news lately, there are a lot of things that are happening with providers dropping plans, leaving certain states, changing plans before they are informing people. There's so much happening that if you just trust that your provider is just going to do right by you, you are in for a surprise, because we all know that the number one thing that they care about is where they can cut costs and how they can make more money. And that's not news. That is just the fact. So let's look at one such news that came out recently, and it happens with United Healthcare. United Healthcare announced they were going to drop 600,000 people just like that. Just like that. 600,000 people are going to be dropped. And because it's probably not profitable for them to be, insuring those people. And so another one happened recently where rural hospitals, if you're a senior and you live in rural hospitals, this was one of them. Rural hospitals question whether they can afford Medicare Advantage contracts, you know, something like that. And then recently, there was another one where 1 million people, 1 million people were told that their plans are no longer going to be provided. And so, how do you deal with that when 1 million people are all of a sudden dropped by a plan in a particular region? And sometimes it's a whole state where they've left the entire state. So here's one of them: 1 million patients to lose coverage as hospitals drop Medicare Advantage. Now, why is that important? Well, about 55 to 60% of all seniors are in Medicare Advantage plans. So knowing what's happening with your plan is very, very important. It is not something that you can just defer. So back to this, I'm telling you that there are three different things that are happening. Hidden cost is going to be included in that letter. Provider changes, so that doctors and clinics may be dropped from your plan's network that you are aware. And most importantly, that you know that your doctor, the doctor that you need, the prescription drugs that you need to be on, the coverage that is essential to you, are all part of your plan. So that's why that letter is important for you to review. So what else is included in that letter that you need to pay attention to? Well, let's talk about it. There are certain steps you need to take once you get that letter. So the first thing you need to do is you need to open that letter immediately when it arrives, because you don't have a lot of time. You have 2 weeks between the time the letter arrives and the time you have to make a decision about whether you're staying with your current plan or whether you're getting a new plan. Sometimes your plan may be dropped, so you don't even have an option but to move to a new plan. But it's important to read that letter and understand that it has serious consequences for you. Then the second thing, and I mean this part very seriously, when you get that letter, you need to get a highlighter out and highlight premium changes, network changes, and prescription drug changes, because those are the things that affect you directly. So you need to make sure that you understand the fine prints, because it's going to be stated in fine prints, and you cannot be bored out of your mind about it and say, okay, I don't care about this. I'm just going to trust that they're going to do right by me. No, they are not incentivized to do right by you. They are incentivized to make money and cut costs and shave things from wherever they can get, make money from. So that's just the system. So I'm telling you, you need to be an advocate for yourself by paying attention to that letter. And then number 3, once you know what's happening to your current plan, you now have to figure out, okay, what does that mean for you? Now you can compare it to other plan options that are available for 2026. And that is where our partner, Chapter Medicare, comes in here. So stay with me and let me explain to you. I've been talking about Chapter for a while, and I think that the most important reason why we are working with Chapter is because they are there to be in your corner. And one of the things that I've promised myself for 2026 is that I am going to help seniors finally get peace of mind about Medicare. Why is that? Because I think Medicare is one of the programs that seniors ignore and do not maximize and get what they deserve. And so, how do you do that? Is by having a Medicare partner that is in your corner, that is going to advocate for you, has no skin in the game in terms of trying to sell you something, but they are there to actually help you achieve peace of mind by getting you into the right plan. And Chapter, our partner, is there to do that for you. Call the number you see. They're there today, Saturday, or you can fill out the form. You go to askchapter.org/insider and fill out a short form. It will take a minute, and then they will reach out to you and help you sort out all these changes that are about to happen that you may not even know about. They have access to all 24,000 Medicare plans and can figure out what fits your need, what fits your budget, and what fits the care that you need. So, as I said, let's make 2026 the year that you finally achieve peace of mind about Medicare. And Chapter Medicare, our partner, is the company to help you do that, because they are unbiased and their help is free. So let's go back to the steps I was asking you to take. We were on step 3. So compare your plan options. And so now that you've compared your plan options and figure out what is available to you, hopefully with the help of Chapter, now you have to make a decision. Now you have October 15th to December 7th to actually make a decision on what you're going to do. Are you going to stay with your current plan? Are you going to move into a new plan? What is your decision regarding Medicare for 2026? And why is all of this important? Well, because in your retirement, in your lifetime in retirement, you are going to get more money spent on your behalf on Medicare, more than you're going to get in Social Security check. And I want to say that again. Seniors get more money from Medicare in their retirement than they actually receive in Social Security check. Why? Because medical care is very expensive. And so but you cannot think that the government is just going to put you in the right Medicare plan for you. That is not how the system works. The government is not there to, put you in the best plan. They're there to provide you the options, and then you decide. So you have to do some work. You have a skin in the game. And a lot of seniors neglect that work. They pick a plan, or the first plan that is pitched to them, or the plan that their neighbor is on, or their friend is on, or their relative is on, and then they end up being part of the 90% of seniors that are in the wrong plan. So one of the things I want to share with you is a simple framework, a simple 3-step process to think about how to approach your Medicare decisions that are coming up soon. So one of the things, that resources that I have, is that one of the guys from our partner Chapter wrote a book about Medicare, and it's called "It's Not Complicated." And so I've read the book because I want to be educated further on Medicare. So it's one of the great books out there about Medicare. He's one of the co-founders. He's a lawyer, and he wrote a book about Medicare and to how to simplify it for seniors. And in the book, he talks about 3 things, 3 P's, on making decisions about Medicare during open enrollment. So I'm going to talk about those three things so that you can think about that when you are about to make a decision about Medicare and how it's going to impact you. So here it is. So the three P's are: number one, you need to review provider. Okay. The first thing, provider. The second, prescriptions. The third, priorities. So those are the three things you need to think about. So let me go deeper. Let me go deeper on the three P's for you. So let me review my notes for a second. So let's start with the first one, provider. Okay. Make sure that your preferred doctors, okay, clinics, or hospitals remain covered. That is the first part you need to think about. Losing network access is one of the top annual notice of change surprises. So when you get that letter that I've been talking about all this time, make sure that you review and make sure that your preferred doctors, clinics, hospitals remain covered. Because when you lose those, that's going to be a problem. The second P is prescriptions. What should you look for there? Cross-check your medications against the updated formulary, because you can assume that if the medication was covered last year, it's going to be covered the same way this year. Even smaller tier changes can cost hundreds of dollars a year. So that's number two. Number three, consider your life type changes. That's priorities, right? So we did provider, we did prescription. Now let's talk about priorities. What is happening in your life that is going to impact your access to medical care? So consider lifestyle changes like travel, moving. If you move and you're in a Medicare Advantage plan, you have to switch because Advantage plans are local based. So things like that affect your plan. Moving or new health conditions. These determine whether another plan is better fit for you for 2026. So you have to review those three P's: provider, prescription, priorities. And then once you do that, you can then, go into open enrollment, knowing that you have done your research, you're armed with the right information, and that you are now ready to have an informed decision, or make an informed decision about what happens with your plan. Now, one of the things that I want to share with you is about Medicare Advantage and Medigap. So a simple way to think about Medicare Advantage and Medigap is that Medigap is stable. Medicare Advantage plans shift a lot. So if you're in a Medicare Advantage plan, you need to understand that when you get that letter, you need to pay extra attention. And let me explain why while I review my notes here. So when you get the letter, annual notice of change plan, and you look at, Medicare plans like Plan G and Plan N are federally subsidized, meaning that coverage is identical no matter who sells them. And so the only difference you're going to get, or the only change you're likely to see with Medigap plans, is the cost. That is what changes. The cost changes. When you come to Medicare Advantage plans, those shift every year. Medicare Advantage plans shift yearly in benefits, in networks, and in drug lists. So that's why I gave you the three P's. You need to make sure that if you're on an Advantage plan, you are paying attention, because everything can change, including the network, including the benefits, including the drug list. So it makes reading the letter especially important. Now, even if your supplement plan stays the same, always check the related Part D plan carefully to make sure that there is nothing amiss about it. So, as I mentioned, our partner chapter is here to help you get a peace of mind about this. So if you don't do anything at all, or you want just to figure out that you are on the right track, call them 539-205-2147 or visit askchapter.org/insider, and they'll be happy to help you. Now, let's talk about the one big, beautiful bill, because that also affected Medicare a great deal. And so let's talk about the impact of the One Big Beautiful Bill and how that affects your Medicare plan next year. So there are three areas that the Big Beautiful Bill impacted Medicare. The first one is it blocked improvements to Medicare savings plans. I'm going to explain why. And then it blocked nursing home standards improvements. And then it limited Medicare's ability to negotiate drug prices. Those are the three areas that the Big Beautiful Bill kind of negatively impacted Medicare. So let's take each of them one after the other and unpack them for you. So let's start with the first one, which is blocking improvement in Medicare savings plan. What does that mean? Well, here's what it means. The law imposes a 9-year ban on implementing improvements to Medicare savings plans, which help lower Medicare beneficiaries, the cost that Medicare beneficiaries pay for premiums and out-of-pocket costs. So they pretty much put this thing in its tracks by saying that no more improvements can be made to Medicare savings plans in the next 9 years. And you're probably thinking, why would they do that? Well, if that's your reaction, you probably haven't been paying attention to Congress, because right now in the environment we're in, they are not about improving the lives of seniors who are struggling. At least that has not been what has happened, especially with the Big Beautiful Bill. And I've told you guys that I am not here to cover politics. I only speak one language, and I've said this many, many, many times. The only language I speak is who is doing something to protect Social Security, strengthen Social Security, strengthen Medicare, protect Medicare. I actually have a mug. Actually, if you go to our YouTube store, this is the mug, that we created recently that says, "We need Social Security," right? It says, "Protect it, strengthen it." This is a mug that is in our YouTube store if you look down below. So no, I only speak one language, and my language is who in Congress is doing something to protect Social Security and Medicare and strengthen it. And I find those people and I see what they're doing, and if it makes sense to me, I bring it to you. So my point is that what is happening with Medicare savings plan out of the Big Beautiful Bill is that it imposes a 9-year ban of improving the Medicare savings plan, which is a program that helps low-income seniors specifically afford Medicare, out-of-pocket costs, etc., etc. So that is not good, and that's something that we have to accept, that it has happened and is the way it is. The next thing that the Big Beautiful Bill did to impact Medicare is to block improvement in standards. So no, that's the same thing we're talking about. The next thing it did was it blocked the improvements in standards for nursing homes and other places. So nursing home standards were being strengthened in order to prevent abuse, in order to prevent seniors being taken advantage of, but those were eliminated. So that is also not happening. So the second change that it did was block nursing home staffing standards that would have improved care for long-term care facilities and hold them more accountable to avoid senior and elder abuse. So that's the next. And then the third one, which you may have heard, the government had the ability to negotiate prescription drug prices, and that was going to bring the cost down for the most common drugs that seniors are using. It allowed Medicare to negotiate directly with the manufacturers and bring costs down. I think they did it with the first 12 drugs, and the Big Beautiful Bill restricted. Obviously, the drug companies lobbied to make sure that they do that because it was going to make them lose money. Anyway, that's a whole rabbit hole because the drugs are already expensive. Have you compared drug prices between the US and maybe Canada or somewhere else for the same drug and realize that we pay astronomically for insulin, things that cost very little to produce, like insulin. We pay a gazillion amount of money for it, but that's a whole different conversation. My point is that the law did restrict the government's ability to empower Medicare to negotiate drugs directly with the manufacturers. So what am I saying with all of this? Well, what I'm saying is that you are going to get a letter. It's called the annual notice of change letter if you are on Medicare Advantage or Part D. That letter is a very important letter. You should not ignore it. You should actually read it immediately, get a highlighter and highlight all the changes that are happening, and then make a plan on how you are going to, improve your Medicare next year, because you have to make a decision. And if you leave that decision to chance, it's going to impact you. So you're going to receive the annual notice, and then you cannot ignore it because there are surprise bills, lost doctors, or missed medications that could be in there that you may not know about. And then you're going to get the letter before September the 30th. And then you need to make a decision about what Medicare plan you're going to go with during open enrollment between October 15th and December the 7th. So that is the crust of what I wanted to share with you today. And I mentioned that when you get the letter, you should think about the 3 P's in reviewing the letter. Your provider, make sure that you're in the right network. Your prescription drugs, make sure that the medications you need are covered. And then your priorities. Have you moved? Do you have new health challenges? Are you traveling? All of those things can impact the kind of coverage you need. And so make sure that you are using the 3 P's, provider, prescription, and priorities, to review your Medicare annual notice of change letter. So that's the second thing you need to care about. And then the third thing, which let me bring it up so that we can talk about it. The third thing is a schedule of what is about to happen. Okay. So that you need to keep in mind, right? 2026 open enrollment. It should say October 15th, actually. Compare plans and then enroll with a Medicare advisor. And I was saying that if you want peace of mind, work with our advisory company, our partner chapter, because they are going to be in your corner. They are the most unbiased advisory company you can find. And most importantly, they will give you peace of mind so that 2026 become the year where you finally get peace of mind about Medicare, knowing that you are in the right plan. And that is my mission for the coming year, to get seniors in the right plan so that you have peace of mind about Medicare, and then you have to, all these changes that are happening are not going to surprise you. So give them a call or fill out the form. I'm going to put it in the link in the description and in the comments. I'm going to pin it to the comments so you can review that. So now I want to answer some questions about Medicare that I've been receiving. And the top 2 questions that I've been getting, number one is, are costs going to go up for Medicare Part B? Well, unfortunately, Medicare Part B premiums are going up by an amount that is actually shocking. So I want to put it on the screen so that you guys can see it for yourself, because a lot, Social Security cost of living adjustment is projected to go up by 2.7%. That is Social Security cost of living adjustment, 2.7%. But Medicare Part B premiums, unfortunately, are going up by a lot more. So just like always, I want to bring you the receipts so that you know where I'm getting my data from. So give me a second, let me find it, and then I'll show it to you. But the number one question I'm being asked is Medicare Part B premium. Yes, it is going up by a lot. 2.7% is your cost of living adjustment projection for Social Security COLA, but Medicare Part B is going up by 11.6%. And I want to show you because I want you to quote me and I want you to see where I'm getting my data from. I thought I had it already open, so bear with me. So that's the first question I'm being asked, and that is the answer. Your Medicare Part B is going up by a lot, and is by 11%. And the crazy thing about that is that the same government that is telling you that you should accept a 2.7% increase in Social Security cost of living adjustment, the same government then is telling you that it's okay for your Medicare Part B premium to go up by 11.6% because healthcare costs have increased. So let's talk about that. You can see right here, this is from Kiplinger, Medicare Part B premium for 2026. It says the premium is currently projected to rise 11.6% to 206 from 185. Now, sorry, I didn't know that it wasn't showing. There we go. So for 2026, the premium is currently projected to go up by 11.6% to 206.5. That is about a $21 increase in your Medicare Part B premium. Now, you're probably thinking, okay, what does that mean? Well, your Social Security cost of living adjustment is projected to go up by 2.7%. So you're getting about a $50 average increase in your Social Security income, but then immediately $21 of that is going to go towards your Part B premium. So in effect, you're getting about a a $29 increase in your Social Security income net. And if you think about it, that is crushing for a lot of seniors because a lot of prices have gone up and stayed up. And the federal government by itself, by telling you that 11.6% increase in Medicare Part B is acceptable, is acknowledging a fact that we all know, which is that prices of goods and services that affect seniors have gone up significantly. And so Social Security adjustment should go up significantly for seniors. But that's not the environment we're in right now. We're in an environment where consistently your Social Security cost of living adjustment is never catching up to inflation. Can something be done about that? Absolutely. Are there bills out there in Congress that is supposed to do something about this? Yes. And I can name 3 of them. There is the Social Security Expansion Act is supposed to fix this. There is another bill that is supposed to put cost of living adjustment at 3.5% minimum. That is also a bill in Congress. And then there's another bill that is in the House that is supposed to reform the way COLA is calculated. All those bills are out there. So it is not that politicians don't know that seniors are struggling and that COLA needs to be fixed because it does not accurately reflect the cost that seniors are facing. It is just that they don't have the political courage to implement these solutions in order to help seniors. And so if you're looking at this Kiplinger article at the top, here's the title. It's saying brace for higher healthcare costs in 2026 and look at projected Medicare premiums. So that is the environment we're in. I don't like it. I've made my views clear. But what matters is that we're all making noise to make sure that these politicians know that this is not okay. So that is all I wanted to share with you today, that there is a letter coming on September the 30th. Pay attention to it, that the big, beautiful bill that was being touted or being highlighted as helpful to a lot of seniors also took away some benefits from seniors when the president signed that into law. And then the third thing is that your Medicare Part B premium are going up higher than we thought. And that's something that seniors are going to have to contend with. If you have any questions, Let me know in the comments. If you like what you heard, hit the like button, hit the subscribe button, and I'm looking forward to seeing you all tomorrow. Thank you for watching.